Hey everyone, Dr. Charlie Johnson, physical therapist, and I'm here to share with you some tips for if you have back pain while you're driving, all right? So maybe you've taken a long car trip and you notice that the longer you sit, the more your back starts to get stiff and or achy, and or you start to notice some pain in the buttock, maybe down in the back of the thigh or into the calf. Maybe you have pain, numbness, or tingling. It starts to shoot down the leg. And then when you try to get out of the car, it's very difficult to stand up straight. So I want to share with you a few tips here if you have back pain when you're driving. So consider this. Back pain when you're driving comes down to basically two things, right? So is it an issue of back position, so the actual spinal position that you end up being in after you're sitting for a while, and we'll talk about that in a moment, or if you have numbness or tingling going down the leg, or you've been diagnosed with and it's been verified that you have sciatica. Check out my video on some various sciatica self-tests. We'll talk about why that's important, but it could be an issue of just nerve tension. So, and especially if these symptoms are down your right leg. So, unless you're a two-footed driver. If your right leg is forward, right, you have tension from your back going all the way down the back of your leg to your foot. So let's talk about back position first. This is for you if you just have back pain and or you have buttock or back of the thigh, even calf pain that is very kind of general, deep, and achy, versus if you have sciatica, it's very electric, like shooting, and or you may have numbness and tingling. So again, this is for you if you have just back pain when you're driving, stiffness when getting out of the car, or you have some achiness in the buttock or leg. So here's what happens, right? So bad drawing, but you'll get the idea. So here you are in your car, right? And after a while, you kind of assume this position, right? So you have some, if you will, rounding in the lower back. Not that that's a big deal, but when you're driving, especially for a long time where you do it repetitively, and you're sitting in the car for a long time, often maybe, as part of your job or something like that, or a long trip, then what happens is your spine gets in this rounded position. So if we zoom in on that, right, what it ends up looking like is this, right? So what we see is that there's more pressure on the front of the spine, right, which kind of stretches out some structures on the back of the spine. Oftentimes, it'll increase pressure within the disc. These would be the bones, and this would be the disc, right? So now, if it's an issue with back position, the one thing you want to do is try to correct that. So consider that your disc and the structures in your body are sort of like sponges. So what we see is that this becomes an issue with blood supply to these tissues, because if you have a sponge that's filled with water, right, and you kind of step on the front of it, well, you'll essentially squish out the water, and or in this case, you'll just wring it out, if you will. So you reduce blood supply to that part of the tissue. Well, if you've been sort of putting pressure through that tissue for a long time, has a hard time getting blood flow to it. So it starts to cause stiffness, soreness, and or pain. Well, then what happens is, and we'll talk about a technique here you can use, is that if you reverse that position, then you sort of, you suck the water back into that structure by relieving pressure on it, right? And you can use this concept to understand what you need to do to resolve this. So in this case, if it hurts to round the back or you're stuck in that position, you need to find a way to change this position, right? So rather than being like this, you could, well, ideally, if this is the seat again, you want to make sure that now you have like a nice little round in the lower, or a little arch in the lower back. So you want to maintain that spine's position as you're driving, versus this slouch rounded position that we frequently get into. So to do that, there are two ways. So one thing we could do is we could, and perhaps you've tried this, put a towel roll right on the belt line. So you could shove your seat all the way, or your butt all the way back in the corner or the crook of this seat. Take a towel roll, start with something small, 3-4 inches in diameter, and after you shove your butt all the way down, push it, and then you'll notice that when it's on your belt line, when you sit up, it'll kind of cause you to be more upright, if you will. The towel roll, you can just roll duct tape or put duct tape or even painter's tape or something like that around it so that it stays in a nice little roll. So you could do that. So that's number one. So if the problem is the spine position, that it doesn't like this rounding, consider that maybe you just need to reverse it, right? So you could use something like this. The other issue we have sometimes, though, is that nowadays we have these bucket seats. That's like a crazy extreme, right? But you're sitting and you're in these deep bucket seats. So what you could do is, another way to change this, right, is that you could put yourself on a wedge. Now, you don't need a fancy wedge. What I mean is just get yourself a couple beach towels or even like a little foam pad. So rather than you sort of being dropped into the hole, if you will, or into the bucket seat, by building it up, you can then help bring up the bottom, which will reduce the angle that your back is placed in. So oftentimes it will allow you to sit up taller with less tendency to slouch. All right, so if it's back position, consider that the most common back position we get into when we drive or sit for a long time is we get into this rounded back position. No big deal, but it increases pressure and reduces blood flow to certain structures, especially some of the ligaments and muscles in the back, as well as the discs in the spine. So to do that, you have one option: put a towel roll 3 to 4 inches in diameter, shove the butt back, put it right on the belt line, and that will allow you to sit up taller. The other thing is try sitting on a few beach towels, or even a I don't know, a couple phone books maybe, or a foam pad that you buy at the pharmacy or something like that. That would be another way to do it. And then the other thing would be, say that you don't want to do any of that. You could do something I would call like a micro stretch. So if you've got that extreme stiffness after you've been sitting for a while and you go to stand, or you know that after 20 minutes your back's going to start to get stiff and sore and you'll start to notice some things down the back of the leg, what I want you to do is, sitting in your chair, or in your car, while you're in the car seat, I just want you to, every 20 minutes, right before symptoms come on, go ahead and try to sit up super tall, hands on the steering wheel, lift the chest and try to sort of arch the lower back. Hold that for 10 seconds and then go back to your normal sitting position. And maybe you do 1 to 3 repetitions of a 10-second hold in that arch back position, just to sort of, that sponge effect, restore the blood flow to this area. All right, so that should help you. So a micro stretch, we'll call it like back arches, if you will, where you're just trying to lift and rock pelvis forward and feel a nice stretch in the lower back. All right, 10-second hold, 1 to 3 repetitions every 20-30 minutes while you're driving. Cool. So now let's just say you're having like terrible pain, numbness, tingling going down the leg. Well, here's often what happens. So consider that in this position, trying to figure out how to explain this. Just get this. So your brain is here. The sciatic nerve is a nerve that runs from the back all the way down the back of the leg to the bottom of the foot. But it's also connected to the nervous system, or to the spinal cord, which starts at the brain, right? So it's a continuous wire, if you will, that runs from point A at the top of the head to point B at the bottom of the foot. So if you pull on point A and you kind of tug it from that direction by moving the head forward, as in a previous video I described the slump test, right? The slump test looks very similar to sitting. So if you do that, you're going to cause tension. And or if this is your right leg and you're constantly pumping this up and down as you're pushing on the gas or the brake, and or you have left leg pain and you're using the clutch, the point is that you're stretching or putting tension on the nerves in the back of the leg and through the spine. So again, this looks very much like what we call a slump test. Just understand that when a nerve is irritated or a bit angry, it doesn't like tension. So what that means is that if you're sitting and you're constantly stretching it because of the position of your seat, then oftentimes it will cause your pain, numbness, tingling to be worse. So the one thing to consider is step 1, try to change the position of the spine and see what happens to the leg symptoms. The other thing to consider is that you might want to try moving the seat forward just try 1 inch. If 1 inch doesn't work, try 2 inches. It doesn't need to be much. It just needs to be just a slight movement, a slight reduction in the amount of tension on the wire or the nerve in the back of the leg for you to notice possibly significant relief. The other thing, without going into it, just trust me on this, is if you notice that you're lifting the leg up a lot to go from gas to brake, you might want to try putting your heel on the floorboard or on the floor in the car and just rotating the leg. So push on the gas and then rotate the leg to push on the brake versus actually picking it up and moving back and forth. The reason that helps is because it kind of helps you prevent firing some of the muscles up in your hip, which reduces some of the irritation or load through the back. So hopefully this helps if you have back pain or leg pain when you're driving. The other thing to consider, again, is if you can't stop and you're sitting in your car, the micro stretch back arches will work fine, meaning it will do, right? So you're sitting, you're driving, every 20-30 minutes you can go from the slouch position to up super tall, right? 10-second hold 2-3 times. You can combine that with use of a back roll. You could try the second thing, a wedge, and then the micro stretches is something I would just do consistently if you have back pain when you're driving, all right? The other thing is if you have the ability to get out of the car, just stand up and just do 10 back bends every time you get out of the car, and then take 1 loop around the car. So you're going to get out of the car and you're going to feel a little stiff. To reduce the stiffness before you get out of the car, you know, you stop, you get gas, you're ready to go grab a snack, do a couple micro stretches or little back bends while you're sitting. Then get out of the car. You should notice that you have less back stiffness. Then when you get out of the car and you're upright, put your hands on your hips and just bend backwards, starting gently and improving the motion as you're able. Do 10 of them, walk around the car, go to the bathroom, do whatever you have to do, and you should be good to go. So if you like this video, you have questions about how to reduce your lower back pain, or you just are looking for more information, comment below or email me directly, charliejonsondpt@gmail.com. Hope this helps. Thanks.